I'm Dr. Tim here at Vertical Chiropractic, and what we're doing today is part 2 of our 4-part series on back pain. And the first thing that we have to do is we actually have to figure out what's causing your back pain. If you haven't taken the time to watch that first video, I would highly encourage that you do. It's a couple minutes long and it's really going to help you understand some of the bigger concepts of what we're talking about today. Now, one of the things that we talked about in the first video is actually making sure that we know how everything is moving, working, and what's actually causing your pain. Remember, 98% of back pain actually comes from some sort of mechanical stimulus, meaning something's not working actually in the back. Whether it be maybe a bone that's tipped one way or the other, maybe a bone's rotated out of place one way or the other, or maybe these bones aren't tipping and rotating with you when you're actually moving and doing things throughout your day. If that's happening, if those bones are not moving as you're moving throughout your day, then every time that you move, whether it be working out, playing with your family, whatever the case may be, then you're irritating the muscles, the ligaments, the tendons, and most importantly, the nerves at that area, creating inflammation, creating damage on the tissues, and ultimately leading to the pain that you're feeling. So the first thing that we have to do is we have to figure out what's wrong. How do we do that here? Couple things. We check your range of motion, we check your posture when you first come in, and most importantly, we take a set of digital motion x-rays. That means we make you move while we take x-rays so that we can see how those bones move with you. Once we have that all figured out, there's a few different ways we go about correcting it. Now remember, in the videos to come, we're going to talk about the strengthening, we're going to talk about the stretching that you can do to help your low back pain. But before we do that, all of those muscles, all of those ligaments that you're stretching, that you're strengthening to help yourself feel better, they anchor to the bone. So we have to make sure that those bones are, one, in the position that they belong, and number two, that they're moving the way that they're supposed to be. So once we have that all pinpointed out, we know exactly what's wrong through the x-rays, through the testing that we've done with you. Now we can actually start making adjustments to get those bones back to the position they belong and working and moving the way that they're supposed to as well. Couple different ways we go about that. Number one, we do instrument adjusting. Very simple, very gentle. So if you're someone who doesn't like the clicking, the popping of the more traditional of what people think about when they think about chiropractic, we can help you out. And I want to kind of show you exactly what we do. So we use this little simple tool here. It's called an integrator. It's very gentle, it's very simple. So what I'll do, for example, on a patient here is we'll be looking at their leg length, we'll be checking reflexes, we'll be touching and feeling through the low back to know exactly what we need to fix. Once we find that spot, it's very gentle. Simply use the instrument, come in here to where we need to adjust, and it's just like that. So again, if you don't like the popping or the clicking, or you don't like the manipulations that you think of maybe when you think of traditional chiropractic, we can help you. Now, the other thing, if you still don't like all those things, but we need to get a little bit more forceful because maybe things are just really stuck, they've been bothering you for a long time, we also have this wonderful table. It's called a drop table. You may have experienced this before, you may have not, but simply what happens, again, we come down to that same spot that we need to adjust, and we can simply prop the table up. We're going to put a little pressure on the patient's back, and you're going to notice that the table falls away. So again, it's a very simple, gentle way for us to make an adjustment to keep you comfortable and provide the best care possible. Now, obviously, the very last way we can go about is the more traditional route, and that is where I will have Susan, go ahead, lay on your side and face me this direction. We can come in here and actually physically come in and move those bones back to where they belong, like so. Okay? So no matter who you are, no matter how your body responds best, we're gonna figure that out the first few times that you're in here and provide you exactly what you need to get those bones moving properly, to get them back to where they belong, so that we can get rid of your back pain and ultimately help you feel, heal, and move the best that you can throughout your life. Thanks for watching. We'll see you guys at the next video.